Behaviorism, which emerged prominently in the early 20th century, marked a significant shift in psychological theory by emphasizing observable behaviors rather than internal mental processes. Pioneers like John B. Watson laid the groundwork by proposing that psychology should focus solely on what can be seen and measured. Watson's ideas were further developed by B. F. Skinner, who introduced operant conditioning, a concept demonstrating that behavior can be shaped and modified through reinforcement and punishment. This foundational shift posited that human actions, rather than being products of unobservable thoughts or feelings, could be predicted and controlled, setting the stage for therapeutic techniques that actively seek to modify behavior as part of mental health treatment. B. F. Skinner's pioneering research in operant conditioning revolutionized the understanding of behavior modification by demonstrating the significance of consequences in shaping actions. Skinner conducted experiments using reinforcement schedules, showcasing that behaviors could be strengthened or weakened based on the consequences that follow. For instance, positive reinforcement increases the likelihood of a behavior recurring, while punishment can decrease it. This systematic approach to behavior modification laid the groundwork for various behavioral therapies, including applied behavior analysis, which remains an essential component of mental health treatment today. Skinner's work illuminated the importance of understanding the mechanisms behind behavior change, providing clinicians with effective tools to address a variety of mental health issues. In the mid-20th century, cognitive theory emerged as a transformative approach that shifted the focus of therapy from observable behavior to the internal cognitive processes that influence those behaviors. Pioneers such as Aaron Beck were instrumental in developing this framework, emphasizing the role of distorted thinking patterns, cognitive distortions, in contributing to emotional disturbances like depression and anxiety. Beck's work identified specific cognitive errors that individuals often engage in, which exacerbate their mental health issues. Cognitive therapy, therefore, sought to equip individuals with techniques to identify, challenge, and change these unhelpful thought patterns, ultimately leading to improved emotional well-being and a greater sense of control over their mental health. Aaron Beck's introduction of cognitive therapy provided a structured method for addressing negative thought patterns that contribute to mental health issues. The therapy focuses on helping individuals identify their cognitive distortions, automatic negative thoughts about themselves and their circumstances. Techniques such as cognitive restructuring and the use of thought records allow clients to scrutinize and challenge these negative thoughts, replacing them with more realistic and balanced perspectives. This integrative approach laid the foundation for the development of cognitive behavioral therapy, CBT, which combines the cognitive strategies established by Beck with behavioral principles from Skinner and others. CBT has since become one of the most widely utilized and researched therapeutic modalities in mental health practice. The therapeutic techniques developed within behavioral and cognitive frameworks have proven effective for a wide range of disorders. Behavioral therapy techniques include exposure therapy, which gradually introduces clients to fear-inducing stimuli to reduce anxiety, reinforcement strategies, which use rewards to encourage positive behavior, and token economies, often utilized in institutional settings. On the cognitive side, techniques such as cognitive restructuring help clients identify and modify negative thought patterns, while activity scheduling promotes engagement in enjoyable activities to combat depression. Mindfulness practices, often incorporated into cognitive therapies, encourage present-oriented awareness and acceptance. Together, these approaches have paved the way for effective interventions for various mental health disorders, demonstrating their versatility and applicability across different contexts. The emergence of behavioral and cognitive therapies has profoundly reshaped mental health practices, establishing evidence-based guidelines that are now standard in therapeutic settings. Ongoing research supports the effectiveness of these approaches, cementing their status as foundational methods in contemporary psychology. Their influence can also be seen in the development of new therapeutic modalities, such as acceptance and commitment therapy, ACT, and dialectical behavior therapy, DBT, which incorporate principles from both behavioral and cognitive therapies. The integration of these approaches highlights the importance of a comprehensive understanding of mental health treatment, emphasizing that effective therapy often results from combining various strategies that address both behavior and cognition. In conclusion, the emergence of behavioral and cognitive therapies signifies a significant evolution in the field of mental health, transitioning from traditional methods to a more structured and evidence-based approach. These therapies offer actionable, systematic techniques that have been shown to significantly improve mental health outcomes and overall well-being. As we look to the future, developments in mental health treatment will continue to build upon the foundational principles established by pioneers like B.F. Skinner and Aaron Beck. The ongoing integration of behavioral and cognitive strategies into therapy reaffirms the importance of adaptability and innovation in mental health care, ensuring that interventions remain effective and relevant to the diverse needs of individuals seeking help.